Hi everyone, good Wednesday afternoon and welcome to GoLocal Live. I'm GoLocal News Editor Kate Nagel. Thanks for tuning in for Smart Health, GoLocal's partnership with the Warren Alpert Medical School at Brown University. I'd like to welcome in dermatologist Dr. Helena Kuhn. Thank you so much for joining us today.
Okay, thank you for having me.
So it's a little cloudy here downtown. If you go on GoLocal Prov, there is a thunderstorm watch for most of Rhode Island. But it is summertime, and of course, in the field of dermatology, really wanted to speak with you a little bit about the latest in research in everything from sun exposure to skin cancer to detection and treatment. So let's talk a little bit about your background, your role at the school, and we'll start there.
Sure. So hi everyone, I'm Helena Kuhn. I work at Brown Dermatology. I'm assistant professor of dermatology at Brown Alpert School of Medicine. I see all types of patients at Brown, skin cancer patients, cosmetic patients. I have a special interest in hair disorders, so love talking dermatology.
So let's talk a little bit. I mean, folks, I think generally know, obviously, summertime months, sun exposure, skin cancer. Let's talk a little bit about the predisposition for skin cancer, if you will. Folks of a lighter skin tone persuasion are often told from, obviously, an early age to take extra precautions, but what's really the latest research in skin tones across the spectrum? I mean, should folks who've got a more olive skin tone, a more darker skin tone, be concerned about sun exposure as well?
Sure, great question. So we know, without a doubt, that UV radiation causes skin cancer. The more UV radiation, the greater risk of skin cancer. The risk is greater in lighter skin types. As you know, those of us who are fair, we burn often, we burn easily, we burn from a young age. You know, people with dark skin, so olive skin, brown skin, you can actually burn and develop skin cancers. I have plenty of Portuguese patients, Italian patients in Rhode Island with skin cancer. Very dark brown skin or black skin. Right? You probably are not at an increased risk of sun-related skin cancers, but this group of people is at an increased risk of hand and foot melanomas, actually. It's not sun-related. We don't know exactly what the cause is, but because we don't often think about skin cancers in dark skin, they're overlooked and they can be a little more deadly. So something to keep in mind.
So you talk about folks, you know, seeing, as you said, some Portuguese folks, Italian folks, of course, lots around here in Rhode Island. Should folks be concerned and really be diligent, again, with sunscreen use and not be cavalier, if you will, with sun exposure? And then we'll go into a little bit about family history.
Yeah. So I'm a dermatologist, I'm biased. Sunscreen, we think is very important, right? The biggest thing you want to aim for is not to burn. So it's important to be outside, to exercise, right? To enjoy the outdoors, as long as you're not burning, right? So it's things like wearing hats, seeking shade, thinking about wearing UV clothing if you are not into sunscreen. UV clothing actually has UV protection woven into the fabric. A lot of people really like that. We do believe in sunscreen. It's controversial as of late. I don't know if you want me to go into that
I would a little bit, because I mean, if people are really reading the news and saying, "Ooh, the chemicals in sunscreen outweigh the effects of potentially skin cancer." I mean, talk to viewers about this.
Right. So there are two types of two types of sunscreen. That's sort of the first thing we want to understand. There are chemical sunscreen, so those are things like avobenzone, oxybenzone, chemicals that are manufactured to place on the skin and block sun. There was a recent paper which showed if you applied them on your skin a few times a day, about 3 or 4 times a day, there was some absorption. Right? Whether the absorption was significant or caused anything dangerous, we don't know. Okay. There's been no studies that show that anything dangerous comes from applying sunscreen, but presumably anything we put on our skin, we absorb a little bit. Anything we eat, anything we breathe in, right? It's part of life. But there are a whole other group of sunscreens called mineral sunscreens. Okay, and those are the titanium sunscreens, the zinc sunscreens. They have gotten very popular lately. They're more natural in some ways. Right? There's elements, but they are the ones that tend to make you a little more white when you apply them. So cosmetically, some people don't like them. There's newer technology which they go on clear. All right, so those are the first two groups.
Okay.
We say in dermatology, if sunscreens are dangerous, dermatologists will be the first people to die because you probably have never seen a sunburn or a tan dermatologist. And that we know that UV radiation causes skin cancer. So
Mm-hmm.
It's the burning and excessive sun that we want to protect against.
Well, what's your take on spray sunscreen, if you will? Is it really a matter of application? Are they effective?
Yeah. They probably are effective. You have to be very careful applying them, right? You've sprayed them and seen them blow away and not go onto the skin. But as long as they're really coating the skin and they're rubbed in, they soak into the skin, they probably are effective. We say the best sunscreens are the one you use. So if you like them, if your kids like them, men tend to like them more because they're easier to apply on hairy surfaces. So there's also the debate about SPF.
Let's talk a little bit about that. Lots of numbers out there.
Lots of numbers, right?
You see the banana boat 8s all the way up to the hundreds.
Exactly, right? Starting on an SPF 30, if you apply, a good amount of that, you really apply a lot, you cover the skin, you're probably blocking about 97% of the sun's rays, which is good. Sunscreen, though, is not waterproof. It can be water resistant up to 40 or 80 minutes. So if you're sweating, you're swimming, you're moving around, you're going to have to reapply a good amount every couple hours. It's the reality.
And for those times that you do get those sunburns, of course, I think folks ask, does that help contribute to the potential for skin cancer? I mean, you hear it's sort of the wives' tales, that one bad sunburn. What's the general school of thought and the research pertaining to that?
You're right. That it truly is burning that increases your risk for skin cancers. And so, being outside protected, slowly developing a tan, I'm not condoning developing a tan, is a little safer. But it really is the burning that we want to watch out for. There's UVA and UVB. UVA we associate more with aging, B with burning and skin cancer. So it really is a very well documented risk.
Let's talk a little bit, again, skin tone. Does family history play a role?
Yes. So insofar as skin tone, right? If you're very fair and your parents have burned easily, they've had a lot of skin cancers, you are at an increased risk. And there are some, it's rare, but there are some genetic predispositions to developing certain skin cancers. So if it runs in your family, it's important to get checked out.
Okay, again, those are regular checks as well. Just of us, you taking a look at what your skin looks like from year in, year out. Because, I've been told, it can be a change to some skin tone or skin moles, or it can be a new one altogether. Yeah. So obviously the importance of seeing a doctor yearly. But what if, you notice something? When's the time to go in to see a doctor and say, this one really looks like it's really changed?
Yeah, no, if you notice, like you said, something new, something changing, a spot that's not healing, a lot of people come in with, which can often be a skin cancer. You think you bumped your head or your leg, and 4 weeks later it's still there. And if something is symptomatic, if it's itchy or it's painful or just feels not right to you, it's better to get it checked out. If you don't have a history of skin cancer, getting a clean check is a good idea. And then you don't need to come annually. Every few years is fine, or if you notice something new.
And how important is early detection in terms of obviously treating it as early as you can and the potential if you don't?
Yes. I love early detection, especially because in dermatology we are a little cosmetically oriented. So I always try to drive home with patients that the earlier detected, the easier the treatment is. Some early skin cancers can be treated with creams, which is really nice. Certain light therapy, more minimally invasive surgical techniques. So better early and safe than sorry, for sure.
And you talk about the predisposition of melanomas in certain dark-skinned individuals. Let's talk a little bit about that. Are those apparent? And the hands and the feet, what do we know about those folks who might be experiencing this?
Yeah. It may be a new dark spot. It may be an area that just doesn't quite feel right. It may actually be a dark line in the fingernail or toenails. Okay? Sometimes those can just be normal moles, but often they do develop in the fingernails. So in people with darker skin types, something to pay attention to. If you have them and you've had them for years, probably fine. But if something's new or changing, even in the fingernails, anywhere on the hands, definitely something to pay attention to.
So one of the things that you were honored was by the American Cancer Society back when here in Rhode Island looking to ban tanning beds for teenagers. Let's talk a little bit about the fake tan department. And especially, let's go from teens to adults. What should we know about tanning beds?
Yeah, so tanning beds are incredibly strong. They're like a super duper dose of UV radiation. And a lot of times teenagers use them to go to dances or proms, I get it. But research has shown very clearly that tanning is actually addictive. It releases endorphins, people like the way they look. So it's very addictive, and as smoking is addictive. It's actually, the World Health Organization classifies both smoking and UV radiation as a type 1 carcinogen. So very dangerous. So very dangerous habit to start as an adolescent.
Okay, so been banned here in Rhode Island. What should folks know? I know you said it's addictive, a carcinogen, if you will. I mean, your stance as a dermatologist, is it use responsibly or just don't do it?
Yeah. So, I'm a dermatologist. My advice is not to do it. If you use a tanning bed before the age of 35, you actually have a 75% increased risk of developing melanoma. Melanoma is the most dangerous type of skin cancer, still very difficult to treat, highly lethal type of cancer. So that's why we work so hard to ban teenagers, because we were seeing a lot of women in their late 20s, early 30s who were developing melanoma and needing really extensive treatments. So we say no.
And let's talk about that new variety. Again, the spray tan. Chemicals, some say better for you, some say organic, obviously topical. There are ingredients in there though, so what's your take on the spray tan?
Yeah, the main ingredient is something, and most of them, is called dihydroxyacetone. It seems to be safe. Not a ton of research on it. Right? It just sort of stains your skin cells temporarily. There is some question as to whether if you inhale it, it can damage the lungs. It could be cancer causing. So I always just tell my patients, great to do, but make sure your eyes are covered, nose is covered, you close your mouth, and you wear undergarments during treatment.
Okay, so let's talk a little bit about the Warren Alpert Medical School and Brown Dermatology. You mentioned a little bit about your practice. What's a typical week like in the life of Dr. Kuhn?
Sure, yeah, it's very fun. I see a lot of patients. I see patients Monday through Thursday, all different types of patients. I see general dermatology. Some days I do surgery. Some days I do laser procedures and cosmetics. So it's really diverse. We also have a residency program, so I do a lot of teaching for our residents. We have medical students rotating through. That's an exciting day. Yeah.
And having been at the Warren Alpert Medical School, talk a little bit about the resource of it available through Brown that's enabled you, again, both in a practice and from a research standpoint, that's been beneficial to you in your academic career here in Rhode Island.
Yeah, Brown in our department it's super vibrant. It's a really active place. I feel grateful to have trained with and work with, I think, some of the best dermatologists in the Northeast and even the U.S. I have special interests in hair disorders, which a lot of people find boring, but I love.
What are hair disorders in dermatology? So for the average person who might not know, I'm sure it's very well known by those who have them.
Yeah, no. So we look at everything from, normal age-related loss and thinning, to disorders that are associated with rheumatologic conditions like lupus, and then also some other autoimmune conditions like alopecia areata, where children and adults fully lose hair. So a lot of active research going on there. The medical school and the department have been great about helping us to establish a specialty center. So it's been really wonderful.
And you had some research on body dysmorphic disorder in terms of folks who want to do cosmetic surgeries. Tell us a little bit about your findings in that. Of course, there are folks who might be predisposed to try to tweak things, but it also can go down another path if folks think that they continually keep needing more.
Exactly. Yeah. And I'm sort of interested in being able to identify that and help people if there is some component of anxiety or depression, sort of addressing that and making sure we're not overlooking or covering that up with cosmetic procedures, and that we're doing them appropriately and reasonably.
I have seen there has been some research, acne, pimples, teenagers, 20s, 30s, the cross-section perhaps of psychology, and, dermatologists always say, keep your hands off of your face, but there oftentimes can be a psychological component to that.
It's hard, it's hard not to. The skin is so tactile that it's hard not to have a psychological component, We think about a third of dermatology is actually dealing with a lot of sort of psychological issues, and so it's an area that I'm trying to develop in a more research-oriented way.
Okay, so what does the year have ahead? I do know that the students are back at the Warren Alpert Medical School. It's here again at the end of August. The school year is around the corner. So you've got your plate full with practice, with your professor hat and with the students as well. What does the year look like ahead?
Yeah, we are expanding a bit. So we're opening a new site in South County in our South Kingston office. So we're very excited about that. We'll be able to do more procedures, have more residents and students with us. We're also working cooperatively with Roger Williams, doing some teaching in their residency program. So that's really exciting.
Okay, very exciting academic research and practical applicability. From dermatology, you're going to get Brown Dermatology with the Warren Alpert Medical School. So Dr. Helena Kuhn, thank you so much for joining us today.
Thank you for having me.
And thank you for watching Smart Health as we bring the smartest from Brown University to bring what they're doing right to you here on GoLocal Live. We'll be back, of course, tomorrow with more, but in the meantime, this evening, find us on GoLocalProv.com. Check us out on Facebook. And again, there is a thunderstorm watch in effect for a lot of Rhode Island. Check the towns listed on GoLocalProv.com through 9 o'clock this evening. So be safe out there. We look forward to seeing you back here on Live. I'm GoLocal News Editor Kate Nagel.